may see that they are attempting to study. You also may have noticed their distractibility and struggle to remain focused. This is a classic example of someone suffering from ADHD on a daily basis through their working memory processes.
Good afternoon, psychology students of Canada. Today we will be introducing, analyzing, and teaching you about students that struggle with ADHD and its impact on their working memory.
So Cam, what is ADHD anyways?
ADHD, short for Attention Deficit Hyperactivity Disorder, is one of the most diagnosed psychological disorders in children and adolescents, but can also present itself in adults. Depending on the prominence and combinations of the symptoms, it can be separated into 3 different types, which consist of predominantly inattentive, hyperactive impulsive, or both types combined.
Now Cam, how does ADHD tend to present itself as we get older?
That's a great question, because the presentation of this disorder actually does change throughout the lifespan. Symptoms of ADHD do tend to decrease with age. In adolescence, hyperactivity and impulsivity tend to be replaced by more frequent inattention type symptoms. Now, previous research has linked these symptoms to deficits in executive function, including mental flexibility, planning, inhibition, and particularly working memory, which Anna will tell us a little bit more about now.
That's very interesting. Thank you, Cam.
So tell me a little bit about the impact of ADHD on working memory.
One of the cognitive deficits that develop because of ADHD is working memory impairment. It has been suggested that this may be an outcome of impaired functions in the frontal lobe. Working memory can be defined as the capacity to store and transform information that is being held in the short-term system. This ability depends on the prefrontal cortex and also underlies several cognitive abilities. Working memory has been often regarded as a more fundamental function that underlies some other executive functions such as reasoning.
Great, thank you, Anna. Now on to our research correspondent, Cassidy Farringer, who will talk to us a little bit more in depth about ADHD and working memory and its impact on childhood development. Take it away, Cassidy.
Thank you for that introduction, Camila. Good afternoon, students. Today we'll briefly discuss the findings of Bauer and his colleagues. Did you know that children who have ADHD are at an increased risk for suicide ideation and suicide attempts compared to their typically developing peers? This risk is partially due to comorbid depression and disruptive behaviors. However, the authors also found that deficits in working memory statistically mediated increased negative affect, as well as increased suicide ideation. These results are very concerning because working memory dysfunction is a hallmark symptom of ADHD.
In 2016, Kennedy and colleagues further supported this finding that individuals with ADHD scored significantly lower on working memory tasks when compared to tasks representative of other cognitive abilities. They developed a new task for assessing this connection and found that it was more efficient than the standard intelligence test previously used.
To gain a more in-depth understanding of this relationship, I met up with one of the most famous psychologists who has studied ADHD for about 45 years, Dr. Russell Barkley.
Thank you, Cassidy. Today I'll be further explaining some of the difficulties that people with ADHD suffer from because of deficits with their working memory. So there are 3 subtypes in the DSM: predominantly inattentive, predominantly hyperactive, impulsive, and combined types. Over development, ADHD is associated with greater risks for low academic achievement, poor school performance, retention in grade school, suspensions and expulsions, poor peer and family relations, anxiety and depression, aggression, conduct problems, and delinquency, early substance experimentation and abuse, driving accidents, and speeding violations, as well as difficulties in adult social relationships, marriage, and employment. As I was saying, so there are 4 executive function abilities: working memory, internalization of speech, self-regulations of affect, motivation, arousal, and reconstitution, all within the brain motor system, which is the prefrontal and frontal cortex. Working memory can be characterized as manipulating or action on the events, imitation of complex behavior sequences, hold events in mind, retrospective function, prospection function, sense of time, anticipatory set, and cross-temporal organization of behavior. Working memory is also affected by behavioral inhibition and motor control, influence, and syntax. So basically, poor behavioral inhibitions is one of the lead deficits that people with ADHD suffer from, which affects their working memory. If you would like to learn more about my theory of ADHD, you can read my book called Behavioral Inhibition, Sustained Attention, and Executive Functions. Constructing a Unifying Theory of ADHD. You can also read my article called Distinguishing Sluggish Cognitive Tempo from ADHD in Children and Adolescents, Executive Function Impairment and Comorbidity. This article is about the ongoing debate within the psychological community that sluggish cognitive tempo, SCT, it should be considered a subtype of ADHD. Through this debate, the evolution of SCT, it compares the executive functioning of children with ADHD to the functions of SCT. So if you'd like to find that out, just read my book and my article. Thank you for having me today, Cassidy, and listening to my spiel about ADHD, its effects on persons working.
Now that we know about the challenges that children with ADHD face, another expert is going to join our discussion. We would like to thank Dr. Barclay for that marvelous explanation. And now for a quick break with our lovely statistician, Daniela.
Thank you for the introduction, Cassidy. Here are some basic statistics about the global prevalence and incidence rates of ADHD. Warning, these may shock you. First and foremost, ADHD is fairly common, presenting in 3 to 7% of all children. It's most common in boys, with an average occurrence rate of 3 to 1 in comparison to girls. In those who struggle with ADHD as children, more than 50% will continue to struggle into adolescence and adulthood. Working memory deficits are also considered a core feature of the disorder. Most children are not diagnosed with ADHD until the age of 7 years old. There are also no real differences in the presentation based on ethnicity, but it is typically most commonly diagnosed in Caucasians. Children in lower income households are twice as likely to be diagnosed with ADHD than those in the higher income. Approximately 6.1% of people struggling with ADHD treat the disorder with medication. Back to you, Cam and Anna, but first, a word from our sponsors.
Does your cat have trouble focusing? Does your cat have trouble reading? Does your cat get distracted when presented with multiple stimuli? Well, look no further, because we have the product that will stop your cat's suffering and yours. Say goodbye to those no good prescription drugs and say hello to Catterall. Catterall will help your cat in so many ways. Catterall will help with alertness, focus, and clarity. Side effects of Catterall include loss of appetite, stomach aches, insomnia, headaches, staring or daydreaming, sadness, euphoria, anxious or irritable feelings, as well as diarrhea, growth of third arm, loss of hair, morphing into dog, talking to humans, and death. No cats were harmed in the production of this film. Catterall is not real.
Thank you, Cassidy, for that enlightening discussion, and thank you to our sponsors. Welcome back to 60 Minutes. My name is Anna, and now we would like to welcome Dr. Eva Okai, a pediatric neuropsychologist, to our panel of experts.
Thank you, Anna. I'm excited to speak with you today.
So far, we have been discussing deficits in working memory and related issues in children with ADHD, but I would like to clarify with you. Do all children with ADHD suffer from working memory deficits?
No, not necessarily, but it is a very common feature of the disorder. Students with ADHD and working memory deficits do have poor academic performance though. So even though their IQ is unaffected, their ability to focus and learn in a classroom setting can be severely impacted, leading to below average academic achievement. So you can see, struggling with ADHD can have a significant impact on someone's daily functioning, and some intervention, whether medical or otherwise, can be very helpful for the individual.
I see. Clearly, it is very important to treat ADHD to reduce these issues in children. Can you tell me about how the disorder can be managed?
Of course. There's no cure for ADHD, but there are many possible treatments. The most effective treatment option is to prescribe stimulants, such as methylphenidate, also known as Ritalin, D-amphetamine or Dexedrine, and Adderall. Antidepressants may also be prescribed in order to reduce the symptoms of comorbid mood disorders or anxiety that may be present. Psychological interventions, such as classroom behavior modifications, can also be implemented, but many of these only have short-term benefits, and they don't generalize well to other settings. So treatment should be provided long-term to be effective. It's also important to educate children, family members, and teachers about the disorder and how to manage it.
Have any studies looked at the benefits of specific medical or psychological interventions?
Yes, in recent years, there's been an emphasis on studying the effectiveness of certain types of cognitive training, as well as medical interventions. So in 2014, Chaco and colleagues studied the benefits of using a computerized training program called Cognitive Working Memory Training, or CWMT. They used a 5-week randomized clinical trial involving children with ADHD between the ages of 7 and 11. The CWMT task was designed to improve working memory through scaffolding. It uses an adaptive, game-like interface, and the training targets both verbal and nonverbal simple working memory, as well as verbal and nonverbal processing ability.
The task involves scaffolding. Can you explain how that works?
The difficulty is tailored to the abilities of the user, so correct trials are followed by more difficult trials that increase the working memory load, and incorrect trials are followed by less difficult trials. CWMT integrates contingent reinforcement, and it implements a coach and parent supervisor to keep the child on track. This study used an experimental group and a placebo group. The placebo group completed the same tasks as the CWMT active group, but with no scaffolding.
So CWMT is cognitive training that it used positive reinforcement. That's very interesting. What was the researcher's prediction?
The researchers hypothesized that compared to the placebo group, children given the CWMT active task would significantly improve in their working memory, academic achievement, impulsivity, inattention, and activity levels.
Were there predictions supported by the research?
Well, the researchers found that children in the treatment group significantly improved in both verbal and nonverbal simple working memory, but not in their processing. However, there were no improvements in terms of ADHD symptoms, such as inattention, activity, and impulsivity. So both groups showed academic improvement, showing that CWMT active was not more beneficial than the placebo task. In other words, the CWMT intervention has specific benefits for select aspects of working memory, but is not an effective treatment for any other domains of functioning in kids with ADHD, which is certainly not ideal.
Those are some interesting findings, certainly very useful for both parents and teachers to be aware of. What other interventions have been studied in the children with ADHD?
So, as we know, psychostimulants improve many cognitive functions in children with ADHD, but it's not clear how they affect working memory. In 2012, Wong and Stevens looked at how psychostimulants specifically affect frontal parietal brain regions, which are important in working memory encoding and retrieval. They studied 18 children with ADHD, aged 11 to 17, who were given a Sternberg working memory fMRI task. These subjects were required to memorize a list of letters, maintain them in memory through rehearsal for 9 seconds, and then to indicate the target letters that they had seen and which letters they had not seen. Wong and Stevens hypothesized that psychostimulants would alter network activation and change functional connectivity in particular regions. The subjects all took Ritalin or Dexedrine, and the researchers found 6 frontal parietal networks that were activated during encoding or retrieval. Medication increased activation of 3 of the networks. Interestingly, medication also reconnected more brain regions into the networks that have been shown to be dysfunctional in children with ADHD.
Wow, what brain regions were reactivated?
The anterior cingulate, ventrolateral prefrontal cortex, and the cerebellum were all reactivated on medication. And not only that, but many changes in brain connectivity were also related to improved working memory reaction time. So it seems that psychostimulants are effective in improving the working memory of children with ADHD, and their mechanism of action may be through reconnecting dysfunctional brain regions into frontal parietal networks. However, future studies should repeat this experiment and compare the findings to neurotypical control groups in order to confirm them.
Thank you, Dr. Okai, for the great explanation.
You're very welcome, Anna.
It's clear that treating ADHD requires the assistance of many individuals, including health professionals, teachers, parents, and the cooperation of the children themselves, in order to be effective. I would like to thank you all of our experts today for joining us to enhance awareness of this disorder. To close today's programs, a word from one of our colleagues here at 60 Minutes, Andy Rooney.
So as we've seen today, Russell Barkley put it best when he described ADHD as a deficit in rule-governed behavior. Over time, ADHD has gone through many name changes. It began as minimal brain dysfunction and was soon changed to hyperkinetic dysfunction. Following this change, it became ADD, a term many still use. However, the most recent update was to attention deficit hyperactivity disorder, and this includes 3 subtypes, as we've mentioned before. Predominantly overactivity, predominantly inattention with no excessive activity level, or a combination of both. ADHD is most commonly noticed when a child is in school, because school is somewhere where a child will encounter the most rules. Imagine being unable to focus on any task in front of you, even though you understand what is being asked. As you can imagine, it would be very frustrating. Working memory deficits can seriously impair someone's ability to function on a daily basis, so treatment can be very helpful and is strongly recommended. There have been many attempts to find the best treatment for those struggling with ADHD, but for now, there's still more work to be done. That's all for now, folks. I'm Andy Rooney, and thank you for joining us on tonight's segment of 20 Minutes.